This is actually the slides that you're supposed actually to see when you have your macroscope. You have the endothelium of the inner layer, which part of the tunica interna, lumen of venole, and this is the lumen of the arterioles. Venole is the smallest branch of veins. Arterioles is the smallest branch of the artery. And again, it has three layers, one outside, one in the middle, and the most inner layer called the one inside. So do you call it tunica externa, the most outer one, and the tunica media, the one in the middle, and the tunica interna, which is the most inner layer. Again, this is just to show you the system, the venous system and the artery system. And you have these two parts of the blood circulation. So if you watch the video that I posted already about the heart, you can figure out that the right side of the heart dealing with deoxygenated blood or the carbon dioxide rich blood, and the left side of the heart dealing with the oxygenated blood. And this is the tissue in the middle, taking whatever oxygenated blood and returning whatever they don't need through the venous return to the heart. We're going through. I'm going just to tell you the name of the arteries and the veins. In most cases, the names are the same. So we're gonna start with the arteries. The first one, this is a brachiocephalic trunk. Of course, this brachiocephalic trunk is a branch from, anyone know? This is a branch from the aorta. So brachiocephalic, if you just break down this word brachio, coming from the brachium, from the arm, cephalic, brain, so brachiocephalic, this one goes to the up to the brain and go to the arm as well. And from that you're going to find the common carotid artery, very important. The common one is going to be divided into internal and external carotid artery, which is very important blood supply to the brain. So once if anything happened to this artery here and the blood doesn't reach the brain for a few seconds, you passed out. So it's very important. So the aorta is going to give you brachiocephalic. From the brachiocephalic, they're going to get the subclavian artery, subclavian, on the top of the clavicle. And the other one will be the common carotid artery. Common carotid artery will be divided into external carotid artery and internal carotid artery. From the subclavian, you're going to have thoracocervical trunk, going to the thoracic and the cervical vertebrae, and the vertebral artery. Vertebral artery will ascend, and next slide we're gonna see what's gonna happen to the vertebral artery. They're going to meet together, forming basilar artery, and then we're going to be other arteries that actually provide blood supply to the brain. This is one. See, this is vertebral artery. This is another vertebral artery. This is actually the base. When you look actually from the bottom to the cerebral cord, to your brain from the bottom, this is vertebral artery. Another vertebral artery is going to meet and making basilar artery. So you can actually memorize this or know about the base. It's actually in the base of your brain. So vertebral artery, the right one and the left one, they meet together and form the basilar artery. This basilar artery is going to give you some branches. One of them will be the posterior cerebral artery, and we have the middle cerebral artery, and we have the anterior cerebral artery. It's right here. So anterior, middle, and posterior. And as you can see here, very important branch called posterior communicating artery and anterior communicating arteries. This actually communicating arteries called form something called redundancy. So just in case, let's say, God forbid, like something happened to those blood supplies here, let's say injury happened here, so the blood actually can always return and go around and reach the other side of the brain. So these communicating arteries is very important. It's like communicating between both sides. So just in case of injury, these arteries actually can supply whatever part of the brain if the injury happened to any side of the brain. Again, this is the aorta, and this is the brachiocephalic, and this is the subclavian artery. From the subclavian artery, you're getting the axillary artery here. And of course, you have deep brachial artery, and the brachial artery itself will actually you measure the blood pressure all the time through the brachial artery here. And brachial artery is going to give you two ulnar artery and radial artery. So of course radius will be, or the radial will be toward the thumb, and the ulnar will be toward the pinky. Okay. You go down a little bit, you're going to find the celiac trunk. This of course gives the abdomen. Another branch, you're going to find another artery giving to the renal arteries. This goes to your kidney, of course. And you have the abdominal aorta, the big one here. And you have the inferior mesenteric artery. Down there, you're going to find the common iliac artery. Common iliac artery is going to give you external and internal iliac artery. I just want you to know, I want you to know the most important names. This is going to give you, as I mentioned before, this will be the external iliac artery. This is internal iliac artery, and this is the inguinal ligament. Of course, this is called femoral artery. Femoral artery, of course, passing through the around the femur. And you have the popliteal artery, called the popliteal artery, and you have the posterior tibial artery and the anterior tibial artery. Vein, the name of the veins probably will be the same with just few exceptions. So whatever you see right here called dural venous sinus, this is actually the main one that returns the blood from the brain to the superior vena cava. But as you know, in the brain there is something called cerebrospinal fluid actually circulating, and this is actually what cools down your brain and protect the brain as well. Here you're gonna find the external jugular vein, and again this is the vertebral vein, like you remember the vertebral artery. This will be the internal jugular vein, and this will be the subclavian and the brachiocephalic vein. So same thing like with the artery, we had the brachiocephalic artery giving subclavian vein, but the difference is the artery give you the common carotid artery will be divided into external and internal, but in this case you're going to give you with the venous system is going to give you internal jugular and external C. Axillary vein under the axilla, cephalic vein, brachial vein, and basilic vein, median vein, and this is a median vein, I'm sorry, median vein, and this is the radial vein and the ulnar vein. It's almost the same, like same thing. Whatever goes down to the internal organs. This is the stomach, and this is the spleen. This is hepatic vein, belong to the liver, and this is the hepatic portal vein. This will be the superior mesenteric vein, inferior mesenteric vein, and this is the inferior vena cava that goes to the right atrium, the biggest one. And this will be the common iliac vein, which is going to give you two division. One will be the internal iliac vein, and one will be the external iliac vein. Same thing in the leg, external iliac vein, inguinal ligament again, and the femoral vein, like femoral artery exactly, and this will be the great saphenous, called great saphenous vein, popliteal vein, and this will be the small saphenous vein, and this will be the posterior tibial vein, and this will be the anterior tibial vein. So the names actually almost the between the veins and the arteries. Second part will be the lymphatic system. Lymphatic system is very, very important. So we have the cardiovascular system, where actually the blood circulating between the oxygenated blood in the left side of the heart and deoxygenated blood in the right side of the heart. But this fluid or the blood need actually, your body need to make sure it's safe and does not carry any kind of like viruses or anything like that. That's why we have the lymphatic system, part of your immune system, actually checking upon the fluid just in case if you have any virus or any bacteria or any something like that, so to kill it and to get rid of it. So this will be the lymphatic capillaries, the green, this green network you see here. This will be the lymphatic system. So those called nodules, lymph nodes. This is very important. Consider each one of this like interrogation system or police station. See when the tissue with the capillaries here between arterioles and venoles, they exchange fluid. You find this green network around it. They take sample of this fluid, send it in one direction to one of those interrogation system called nodes. These nodes is going to have like several rooms where actually they're collecting samples, and inside those rooms there is a police officers or immigration officers, if you want to call them, if you consider this as an airport and you want to check on all the passengers that come to the airport. So inside this airport or inside interrogation room, you're going to find the immigration officers that check everyone passport. Same thing, you have lymphatic cell or lymphocyte, lymphatic cell, or we call it lymphocyte. Check on the fluid sample that were collected from this network between the arterioles and venoles. And if they find anything wrong, they just kill it and get rid of it. And of course, all the fluid will go up and will be collected at the lymphatic trunk, and it's going to pass through the subclavian vein, from subclavian vein to the superior vena cava, of course, to the right atrium. Same thing, the network on the top here. This is lymphatic capillary. It's going to collect blood, liquid or fluid sample and investigate it. If anything wrong, it's going to kill it inside those nodules or lymph node, and would be sending the fluid again to the subclavian vein, from subclavian vein to the superior vena cava, where it's going. We call them afferent lymphatic vessel, and this one actually with all the fluid exit, we call it efferent lymphatic vessels. We call it efferent lymphatic vessel. It's exactly like afferent and efferent in the nervous system. Afferent in the nervous system be the receptors in the skin sending the sensation, let's say, to the spinal cord. Okay, so carrying sensation would be sensory. This is, we call this afferent. And let's say the brain wanna give order to the muscle to move, is gonna send them motor to the muscle to move. This branch, we call it efferent, the motor one that provide movement or order. We call it efferent. Same thing. So whatever collecting the fluid will be afferent lymph or afferent lymphatic vessel, and when the fluid exit, we call it efferent lymphatic vessel. This part called hilum, and actually it looks like a bean shape. It looks like a kidney. When you study the kidney, will be next semester will be the same, probably the same shape. But as you can see, the fluid is going inside. They have different compartment, different rooms. As you can see, we call it nodules, and between them sinuses. And of course, there is inside those nodules, there is a lot of lymphocytes that investigate this fluid, trying to find out anything that is not good to kill it. And then the fluid will pass to the other side and will be exiting through the efferent lymphatic vessel. And of course, this will go to lymph duct, and then from lymph duct to subclavian, from subclavian going to superior vena cava to the heart, to the right atrium. The 25% of the body, the right side, this 25% is actually drained by right lymphatic duct. But the 75%, all the rest of the body, this one, is drained by the thoracic duct. So thoracic duct are actually doing bigger job than right lymphatic duct. Lymphatic duct drain only 25%, but the thoracic duct take care of the 75% of the body. Of course, this is the different part of your immune system or lymphatic system, the tonsils, one of them. And you see, as you can see, you have like cervical lymph nodes, thymus, part of the lymphatic system. This is axillary lymph node, and spleen is part of the lymphatic system as well. And as you can see, you have a lot of abdominal, pelvic lymph nodes. So you see everywhere, you see these lymph vessels, popliteal lymph nodes. So the fluid actually go all the way, passing through the nodules, just in case if they find anything wrong, and will be collecting through the subclavian, from subclavian vein to the superior vena cava. Again, this will be the lymphatic trunk, the jugular one, and this will be the right internal jugular vein, and this will be the right subclavian, right subclavian. This will be the left internal jugular vein, and this will be the left subclavian vein. Both goes to superior vena cava, the biggest vein, and the right atrium. And this big nodules here called cisterna chyli, big one in the abdomen right here. And this will be the lymphatic trunk from the lumbar and intestinal. So it's a very thorough action network that investigate the fluid from the arterioles and venoles, clean it up, and send it back to the blood circulation through the superior. This is what you see under the microscope. This will be the medullary sinus. This will be the germinal center of the lymph nodules. This will be the capsule, most outer part. And this will be the cortical sinuses. Very well designed actually to suit the passageway of the fluid, to be able to filtrate these fluids, and if there is any virus or anything, bacteria or anything, it can kill it and just send it back to the blood circulation. Again, same design. You have the capsule and you have the cortex of the lobule. This is the lobule, like sectors or lobe. This will be the septum of the connective tissue, and this will be the lobule, and this will be the medulla of the lobule, and this will be the cortex of the lobule. Again, the capsule. This actually in the spleen, you're going to find white pulp, and you're going to find red pulp. These actually, both pulp actually filtrate the fluid and the blood. Tonsils. You have the tonsillar. You have the tonsillar crypts. You have the nodules again, epithelium, and this will be the pharynx. See all these sectors and crypt. This is actually the places where you can find pulse, so you can actually measure the pulse of any person. Of course, this is not convenient to measure it from the temporal artery or the facial artery and the common carotid artery. You can feel the pulse here, but the most common one will be the radial artery. Of course, you have the brachial artery as well. This actually usually you measure the blood pressure here, blood pressure. The most common site will be the radial artery, where you actually can feel the pulse. Of course, this is femoral artery, popliteal artery, posterior tibial artery, and dorsalis pedis. All those places actually can feel the pulse, but the most common, this is how actually you measure the pulse with 2 fingers. And I think it's far away from the styloid process of the radius. You just find the groove at the side, you just try to feel the pulse, and you count for 1 minute, probably be 70 something pulse per minute, from 68 to 77. Different, of course, if the person athlete do exercise here, sorry, and 120, and the last beep you hear 1070, so the blood pressure will be 120/70. And you, of course, this is, you insert the stethoscope here, and this is what I was talking about. You close this knob here, and you keep pressuring, pumping the air, and this arrow will move from 0 until it goes, let's say 180 or something, or 200. Then you release this very slowly, so you can actually watch the arrow here goes down slowly. Why is the arrows going down? The first sound you hear, this will be the systolic. Let's say you hear the first sound on 140. This will be the systolic, and the last sound you hear